In the next video of this series, we will be discussing patient advocacy, which will cover such topics as groups that can advocate on your behalf and how to advocate for yourself after a cancer diagnosis.
In Part 6, we will be discussing how to become a patient advocate. Feel free to download these slides and use them at any time. Becoming a patient advocate can not only benefit a specific patient, but future research for the disease as well. Once a patient is diagnosed, they may not know where to start. Patients should know that they have access to different support groups, mental health groups, and advocacy organizations. It can make the diagnosis easier when asking medical questions, looking for support groups, and learning about their newly diagnosed disease. Advocating for yourself is one of the most important things when looking at cancer care. Once a patient becomes diagnosed with cancer, many different treatment options and choices are presented to them. The patient may become overwhelmed and not know where to start after receiving a diagnosis. They're going to have a lot of questions and may not know who to ask those important questions to. Asking your healthcare provider questions can ensure that you are comfortable and have a good knowledge of what is going to happen within the treatment. This also can be done when researching advocacy support groups, certain doctors or cancer care centers, and any other questions that you may have along the way. They are there to make the patient feel comfortable and cared for. They also want to make sure you are utilizing these resources. Some of the services healthcare centers offer are listed, such as mental health services, support groups, and other cancer patient and nutrition exercise groups. These will be offered through your cancer care center, and never be afraid to utilize them. Self-advocacy is one of the most important things to stick by when you're diagnosed with cancer. By attending the support groups and educational sessions, it can help teach you how to advocate. Don't be afraid to ask questions like financial support, transportation to appointments, and childcare services. Many cancer care centers provide these amenities. Prepare a list of questions in advance, take notes when speaking with your team, and speak with your doctor to know how much information you would like to receive up front. Don't be afraid to speak up when you don't understand or you have a question. Buddy programs both offer one-on-one support not only to the patients, but their family members as well. They make sure that the family and caregivers both understand the treatment that the patient will be going through so they can be there and care for them during this hard time. Having other family members familiar with the treatment can also help them when the patient becomes stressed or has questions. Listed are some patient advocacy groups that you can utilize when finding out when you are diagnosed with cancer, such as the Patient Advocacy Foundation, the National Association of Healthcare Advocacy, and Society for Healthcare and Consumer Advocacy. They are here to help patients know their treatment options and help them answer any questions that they may be asked. The main goal of these organizations is to advocate in the name of the patient. Large-scale involvement includes advocating for public policy and connecting with legislation to increase the advocacy within Congress and their legislators. You can also hold fundraisers and participate in events that help raise money for cancer research and patient care. Educating others about cancer can also increase the advocacy and the awareness. Listed are some references that you can use for this PowerPoint.